Hello and welcome to Decentralized Health Administration at the Ubrica Project. My name is Dr. Macharia Waruingi, and as usual, I bring you critical technical knowledge about creating perfect conditions for much needed revolution in the health industry. Under these new conditions, universal health will be accessible or will be possible, and everyone in the world, including you and your loved ones, will have access to the best health services available. Health for everyone will be of the highest quality there is in the world, and it will be affordable by all. As usual, I come to you each and every day from Ubrica project located at 1.4 degrees south of equator and 37 degrees east of the central meridian, that is somewhere in the southwest suburbs of Nairobi. And today I've got great news for you, or great important information. As you know, we've been discussing how healthcare is developing, and recently over the last few episodes, we have talked about global health, its origins. We have even seen where global health went wrong and the centralized architecture. That's what we discussed yesterday. And today, we want to explore what we could do if we could see the future. What does it look like? And of course, this material is, I've told you before, is accepted from Decentralized Health Administration textbook, under development by Susan Nyambura Njuguna in the Ubrica Research and Development team, plus many other fellows in that group. Well, let's now first look at the basics. People ask, what is the Ubrica project? And we say that Ubrica project strives to solve three fundamental problems of health production in the world. And we say that the three fundamental problems include lack of access to health services, and the poor quality of medical services. And the third one is high cost of medical services in most parts of the world, particularly in Kenya and, of course, in Africa in general, where we are right now. Lack of access to health services occurs when people do not have money to go to hospital. So if you don't have money, any money at all, you are not going to be able to pay for the trip to the hospital. And even worse, because of lack of money, you won't even have food. So health is compromised from the word go. Then, of course, we know that lack of access can also occur where there are no hospitals to go to. So we have two fundamental problems. One is there's no money to go to the hospital, and the other one is there's no hospital to go to. The poor quality of medical services occur when good knowledge to deal with medical problems is scarce. And then, of course, we know that good knowledge may be scarce if the education system is not sound. High cost of medical services in most of the world, particularly here in Africa and in Kenya in particular, occurs when manufacturing of products that can be used to improve health is stifled. And so, how do we solve these problems? We solve the problem of lack of access due to lack of money by creating Soko Janja. Soko Janja is an online retail store where everyone in the world can sell what he or she has produced to increase earning power. Money in the pocket means realized access to health. Ubrica retail clinical centers and clinics and hospitals project ensure physical access to health services, because when you have a clinic nearby, you can go there and get some diagnosis, of course, for prevention and even for treatment. Ubrica's science and technology parks create places for translation and commercialization of new and relevant knowledge, ensuring the best quality of medical services in the world. And then our Ubrica Biomedical Industrial City will promote local manufacturing of biomedical products, reducing the cost of medicines and medical devices and health services in general, making health affordable to all. So when we have manufacturing locally, then we don't have to import everything, because it's due through the importation that the cost of health care becomes very high. Ubricoin, or UBN, our cryptocurrency for universal health access, underwrites the health production in the Ubrica ecosystem, such that if you have Ubricoin, then you can have access to medical care in the future. Now, you can support, because you're asking how do you participate in all this, you can support universal health access by getting and adding Ubricoin to your portfolio of cryptos, or by getting equity in the Ubrica project. So we ask you to get involved. Do not sit on the sidelines of health. You can get even more involved by joining the World Ubricoin Ambassador Program, WUAP, where you gain deeper knowledge about Ubrica project and continually share that knowledge with people in your circle of influence. As an ambassador, you will be the bridge between Ubricoin, Ubrica Sokojanja, and the people in the world. That's really great. So start getting involved right now and hit the like button to cement your support. And also hit the bell button so that you can subscribe to receive notifications from the Ubrican, and also participate in the chat below. Share your views on how we can decentralize knowledge in health and medicine. All right, let's look at today's topic. We're talking about if we could see the future, what would it look like? Again, this matter is accepted from Decentralized Health Administration textbook under development by Susan Nyambura Njuguna and Ubrica Research and Development Team here in Nairobi. So yesterday, we spoke about architecture of global health and how it went wrong and how we could change it using systems thinking. Now, if you haven't watched that video, look at Decentralized Architecture for Global Health Administration. That's a video made on July 17, 2019. And let's go to the next level. We're saying like by changing the architecture of global health, we shall, over the next few decades, let's say maybe next few years, we shall save lives of millions of children and adults, build health benefits to individuals. Decentralized global health will directly link to the economy, or is directly linked to the economic productivity and growth, the economic growth. We know that economic development of every individual, that is the opportunity for everyone to make money. And I want to emphasize this, the opportunity for everyone to make money is the first line of defense against health threats. Such opportunities for increasing selling power of an individual are to be found in the ease of finding market for their produce, products, and services. Let me just repeat that. Opportunities for increasing the selling power. Like if you have something, you are able to sell it. They are to be found in the ease of finding market for produce, products, and services. You know, it sounds easy to say, but I can tell you in this African continent, it is very, very hard to find a market for anything. It is very difficult to sell anything because everything is imported from somewhere else, including knowledge, including technology. Everything is imported. Without market, people are doomed to fail. And that's why it's very, very difficult to generate revenue. Now, good market brings money home that we can now use to pay for health and other services. The most challenging problem in Africa is the severe lack of market for almost everything that is produced in Africa. Not only is there no market for farm produce, as cartels gang up to import literally everything, including onions, eggs, fruits, and the like, there is no market for educated professionals, as large government projects such as the highway construction, airports, railroads, and the like are outsourced to foreign companies who come with their own employees. What a big shame. This means that graduate engineers cannot find jobs. Same plight applies to medical, doctors, lawyers, architects, etc. There is simply no market for local farm produce or locally produced knowledge. To overcome this problem, we have to decentralize market governance and to distribute market access to everyone. When people have money, they can overcome the most basic health threats. That is number one. Like that's the first line of defense is get people to have money so that they are wealthy. And then when they have money, they will know how to fight diseases. That's it. Number two, well-built and well-maintained public health infrastructure geared towards both prevention and preparedness is the second line of defense against health threats. Now, activities related to prevention, epidemic investigation, and control of diseases require sophisticated level of decision making, resource coordination, and substantial financial resources contributed by local people. This means if local people have to contribute, they have to have money. And where did they get money? They got money from the market. So this requires for local people to have resources and to be connected to a decentralized data gathering system built on blockchain. we cannot escape from blockchain if we really want to decentralize health itself. Such data collected in a decentralized manner should be analyzed by machine learning to build intensive local knowledge networks for artificial intelligence. Now, the resulting interconnectedness of the whole world and interdependency of countries, economies, and cultures will bring improved access to goods and services, and of course, increased access to market. But we have to build this market ourselves. For example, today the burden of infectious diseases rests predominantly with the low-income countries. These diseases, however, represent global threats. That is why even if you live in Europe or United States or some other developed country, which so-called the G20, the infectious diseases are going to come to you unless you join hands with us. We do this together. Get Ubrica on cryptos. The primary duty to produce global health is to raise the income of all people through careful use of information technology to increase access to market for the masses. We have to have market for everyone. You cannot have some people in certain countries producing all the goods and then they ship them to other countries, and those countries do not ship anything out, and that means that there's going to be market inequality, and they have a very huge inequality in health, and of course the we have health threats, particularly many emerging infectious diseases that come from poor countries or poor places where people are poor, because when you're poor, even the bacteria knows you're poor, is going to attack you. What about the virus? The virus will just annihilate a whole village. What about parasites? All these things, bacteria, parasites, fungi, they know poor people and they attack them and kill them. So, and of course, those who don't die flee from such places and then they transport the diseases elsewhere because, we have major global interconnectedness. Someone is likely to buy a ticket from here, Nairobi, and travel to Brazil or travel to China. So someone from China will travel to United States. Someone from United States will travel to Europe. And you can see how if we are not conscious, we don't wake up to this problem and contribute support, contribute funding. We work with cryptocurrencies and the blockchain technology. We are going to be seeding ducks for these diseases. There's a lot of money that has been put in other projects in the world, for example, in engineering, in information technology, in, you could say, manufacturing, even space science. We haven't put serious money in health production. We have not put serious money in health production. So it doesn't really matter how much money we put in all the other things, but if we don't put money in health, then we're wasting a lot of time. Because even if we know we have the space technology, we are not leaving the earth soon to go and live on Mars. All right? No, we're going to be around here. And we have to coexist with bacteria, viruses, parasites, fungi, all these things. And if we deny money from certain groups of people or deny access to market, let's say we deny access to market from certain groups of people, then those people are likely to get those viruses, parasites, bacteria, and fungi, and then they are likely to transmit them to those people with money. And then, of course, we have not done anything. This is why this social inequality, let's say economic inequality, where some people are big producers and some people produce little and nothing because there is no market for whatever they produce. Blocking the market for each other is not going to help. So let us say we open market for everyone, buy things from each other. Let us bring the market to the local people. Let us let the local people, allow local people to sell their products, produce, and services. It is unbelievable that a country like Kenya, we train a lot of doctors every year, and more than 50% of those doctors have to leave the country each year because there is no market for doctors in Kenya. Can you believe that? There is no market for doctors in Kenya because once they graduate, there is no employment. The ones who have been working before are going on strike. Almost every year, there's a huge strike for doctors trying to demand to get paid. And what does the government of Kenya do? It goes to another country to import doctors to come and work in Kenya. Yeah. So what does that mean? So there is no market for engineers in Kenya. And of course, a lot of engineers graduate from all the universities we have around. But instead of engineering getting jobs, what does the guys in the government do? They go to another country, get an engineering company to come and build superhighways for us. Well, they're nice superhighways when they're done, but there's not a single Kenyan engineer employed there. And this means that all the engineers graduating cannot find jobs, civil engineers, let's say. Same with electrical engineers. And so all the construction work, large infrastructure projects do not provide employment for local people. And then who end up paying for all that work of imported engineers and imported technologies and imported companies? Kenyans have to do that. And this is not a problem just in Kenya, it's a problem throughout the African continent. Now, maybe if we gather money through other means, like working with cryptos and blockchain, we can gather sufficient amount of money to do large-scale engineering projects like Ubrica Biomedical Industrial City, and make sure that such a project is fully done by local people. Whether we're talking about Nigeria, Mozambique, Tanzania, let us decentralize decision making about investment in large capital projects in Africa. These large capital projects are the ones that provide employment for masses of graduate students coming from universities, whether they're graduating in bachelor's degrees, whether they're graduating with master's degree or their PhD. Literally at this point in Kenya, there are no jobs for such graduates. And we have so many universities graduating more than 30,000 people. That is not right. So we are saying that the future is different because the blockchain is here. And of course, it is now possible to create alternative money that can be used to can be invested in projects, whether it's low scale subsistence cropping, producing crops to feed the village, whether it is intermediate level of investment in retail system, whether it is in large capital investment for large capital projects. Let us gang together, work on the blockchain, see how cryptocurrencies can help us get out of this, because without doing that, we don't have health. Money, money comes from the market, and without market for knowledge, there is no money. So Ubrica plans to achieve global health by working to produce health in every individual. We have to think about every individual and where does this individual get money. Production of health of an individual relies on production of health maybe in animals and the environment. And of course, we call this the one health theory. The mode of production, if the animals are not healthy, then the individuals in our community are not going to get healthy. And guess what? Animals contribute more than 80% of the diseases that end up becoming pandemics, yeah, or epidemics. Let's talk about meningitis, what comes from cholera, what's coming from malaria, even tuberculosis. You talk about Ebola, where's this influenza virus diseases in Middle East, syncytial virus, and chicken flu, avian flu, all these things come from the animal kingdom. As you can see, the relationship between animals and humans become very, very important. Now, why do animals transmit their viruses and bacteria and fungi to humans, or even parasites? When humans live very close to animals, and why would we humans live very close to animals? Because they don't have money to build good structures to separate them from where the animals live. Either they live close to the forest so that they can go and get animal protein, it's called bush meat. And as you're seeing in West Africa, we get Ebola. Or they live with animals in the same house for security reasons because they cannot afford to have a very nice security fence for keeping their animals out. So the animals have to live in the house. We have to do that here in Africa. So when animals live in the house or you live near the forest where animals live, either way, viruses and bacteria and fungi and parasites will get to you. And of course, when they get to you, the viruses are not used to living in human beings, and human beings cannot handle them, and so an epidemic begins. What about the environment? The physical environment, this is the built environment, and also the natural environment. Mainly the physical environment when it's dirty, there's unsanitary conditions, like we saw what's called living conditions of squalor, which means extreme absence of money. When that happens, then people tend to get all sorts of diseases because of congestion. Like Nairobi has got some of the largest slums in the entire world, and those slums become a machine or a factory for producing diseases. So what we see in repeated incidents of cholera, you know cholera, meningitis, tuberculosis, and that's not good. So if we have the only reason why people are living in such an environment because they cannot afford a nice house. Again, they can't afford a nice house because whatever work they do, they are not paid because the jobs have been outsourced. So if you go to slums of Nairobi, you will find professionals, people who are graduated from university. Some of them have master's degrees, others have PhDs, but they have to live in a slum. Why? Because the government has gone outside and outsourced all the work, and our engineers cannot find jobs. Yeah, including our doctors, they cannot find a job. Even lawyers and dentists. And of course, now that lowers the living standards and destroys the living condition. People do not have an option but to migrate to the slum area. And because that place is much cheaper to live, of course, there is no running water. It's just a messy, messy place. I'm saying again, the only way we can solve these two problems, the connection, the relationship between animals and the environment, you know, and human health has to be understood well, and that relationship cannot work on conditions of absence of money. So money is the fourth element. We will say that one health includes the health of the human, let's say the hosts, the health of the human, the health of the animals, and health of the environment. We call that one health model, and we have been talking about it since 1970s. We have not succeeded in stopping epidemics from happening because we're lacking one more element, that is the money itself. And we know that money, the fourth element of health production, as we have come to find it here in Ubrica, is the most important element in production of health of humans. That without money, human beings are not going to improve in health. We say that economic development is the greatest cause of improvement in health, but we know it's not just general economic development like the gross domestic product of the nation, but the economic development of each individual. So what Ubrica plans to do is work on that level to increase the selling power, not the buying power, to increase the selling power, because there is no buying power without selling power. For where is the money going to come from to buy things? Yeah. So we have to work on the selling power of the people. And working on the selling power means creating markets that maybe online marketplace. There is nothing more efficient than the internet. And now the internet also becomes completely decentralized by the blockchain and decentralized markets that are not invadable by cartels. That is where the power is, the power to produce global health. So, ladies and gentlemen, thank you so much for taking time to listen. We have a lot of news to unpack and information to unpack, but I want to stop there today so that we don't overload. But we have said today that market for local produce, local knowledge, local services, and local products is everything. And we can use decentralized applications, which allow everyone to take part in decision making and allows everyone to take part in selling. And of course, cryptocurrencies, which mean decentralized money that is uninhibited, that is uncontrolled by some local cartels, and money that is issued to the people, not just the rich people, money for the people. And I had yesterday, recently, Andreas Antonopoulos. You might know who that is. He's the author of two books, the Mastering Bitcoin and also Mastering Ethereum, giving a lecture over there in Scotland, and he said that now we have three types of money: money for the people, or money by the people, which is now digital currency, or like Bitcoin, of course, Ubricoin, that's money of the people. And then you say money of the government, that is money. fiat currency, which we also call legal tender, and then we have money of the corporation, like what is produced by Facebook and known as Libra. Now we're talking about the money of the people, reaching the people, helping to uplift the people to create market for their produce, products, and services so that they may have access to health services. Again, we said that Ubrica project strives to solve three fundamental problems of health production. That one is lack of access to health services, and it is not possible to access health services without money, and the poor quality of medical services that we experience here in Africa. And that occurs because of lack of knowledge, because the knowledge production system is not working too well. The quality of knowledge coming out not so good, and mean the quality of medical services not so good either. And then, of course, the high cost of medical services because we cannot manufacture anything. We say that Soko Janja is the online retail store where if anyone in the world can sell what he or she has produced, and that means money in the pocket, and money in the pocket means realized access to healthcare. The Ubrica clinics and hospitals, particularly Ubrica retail clinical centers, ensure physical access to services, and then the Ubrica's university science and technology parks create places for translation and commercialization of new and relevant knowledge, ensuring best quality of medical services in the world. The Ubrica Biomedical Industrial City promotes local manufacturing of biomedical products, reducing the cost of medicines and medical devices and health services in general, making health affordable to all. You can support universal health access by getting and adding Ubri coins to your wallet or to your portfolio of cryptos, and of course, trading those cryptos, or by getting equity in Ubrica project, or by getting involved. Do not sit on the sidelines of health. Get even more involved by joining the Ubrica, the World Ubricoin Ambassador Program, where you can gain deeper knowledge about the Ubrica project and how it works, its goals and vision, how to decentralize health and make health access possible. It's called universal health access. And you can continually share that knowledge with people in your circle of influence. As an ambassador, you'll be the bridge between Ubrica, Ubrica and Sokojanja. We really look forward to continuing working with you. If you have any questions about the Ubrica project, please do not hesitate to ask. Please, you can send your questions to info@ubrica.com. Info@ubrica.com. We'll be very happy to respond to you. Now we have to say goodbye. Thank you so much for listening.